to part three of the interview with Neil Woods from Leap UK. In this part, we talk, more about drug policy reform. We talk more about Leap. We talk about about Neil's experiences undercover. Amazing story. Thanks for joining in. More generally, so then I guess it just needs the sort of the kind of political will to do it, and that's just that just takes the right person at the right time, I guess.
Yeah, I agree to a certain extent, but I think it's important, and this is important to say, because anyone listening to this or anyone who engages with this topic, that if you're in support of reform, then it's your responsibility. It's the responsibility of every one of us to do something, because that's the social movement. Now, you mentioned Roy Jenkins, and another great figure is David Steele, because David Steele brought up. He made significant social justice changes as well. Abortion, he changed abortion law, I believe. But that wasn't political leadership which led to that point where it could change. It was the social movement which led to the situation where finally a political figure decided to take up that flag and go with it. And yes, we are right to celebrate people like Roy Jenkins, David Steele, Barbara Castle, whatever political figure is famous for certain steps forward in social justice issues. Yeah, okay, but it's the activists. It's the ones whose names we don't remember who are important in that struggle, and that means the emphasis is on every single one of us to try and help that social movement grow, and that's how those figures will eventually pop their heads up. I would say we all have to take responsibility, but in terms of a political figure, I wonder if we are on the cusp of someone taking up that flag in Scotland, because there's a different vibe in Scotland. There is much broader support amongst the public for incremental reforms, and it's adding to the nationalist sentiment, because there is a clear political narrative that Westminster policies are killing Scottish people. Now, that's a narrative which means that drug policy gets booted around like a political football, and in some ways that's problematic, but it still happens to be true. So I had a meeting last night with Leap Scotland. We have a rapidly growing membership of Scots, of Leap Scotland. And they're getting very active at the moment. They've got an individual launch date on January the 19th. One of them started work in Leith, by the way. That's where he started his work, and that's where a lot of his views were formed. Again, for exactly the same reasons as you said earlier on in our chat. So Scotland, there's an opportunity here in Scotland, especially with the heroic activities of Peter Crikant, who's been doing his guerrilla drug consumption room in a van, that he's creating a moment where the recent crisis of the drug deaths announced in Scotland has genuine political leverage, because what Peter is doing is he's presenting a policy option which can do something about it, but he's also emphasizing the lack of political activity. So there's this beautiful moment where, with the right people pushing in the right way, it could make a major shift, and also hopefully dramatically create maybe even a constitutional crisis about drug policy. Because if Scotland decides to do something which Westminster says is not legal, well then the debate really is up front and centre, isn't it?
Yeah. And I mean, anecdotally, my best friend still lives in Leith, and he's saying, while in some ways that Leith is transformed beyond all recognition, at the same time that really soft underbelly of people in crisis is growing. So you have this real, there's this sort of inequalities that are becoming more stark in somewhere like Leith. So one of the things that he's working on, and I might well be adding my own sort of energy to it, is a sort of social enterprise, and sort of segueing into what the discussion around psychedelics. I think psychedelics is potentially got a hugely transformative potential, in places like Leith, in places like Moss Side, places like Highfields. Because I've lived there and I've seen it. I've seen it firsthand what goes on there. On both sides of it, and in my kind of recent experiences with kind of psychedelic and plant medicines. I mean, my experience, my feeling, my belief. I mean, I'm quite a skeptical person, and I'm quite, I like to listen to both sides of arguments, and I understand it's not all completely black and white and there's shades of grey, but I am 100% convinced of the transformative potentials of plant medicines used in the appropriate way in these communities to kind of break cycles of trauma, break cycles of addiction, and ultimately kind of benefit people kind of from the bottom up. I'm so excited. I've had goosebumps several times throughout this conversation, by the way. Just when you talk about because I can just feel the sort of like the energy of LEAP, and I can see the kind of, like you say, in that whole discussion around activists and that activist energy pushing things forward. 100% agree with you on that.
Well, I mean, it's something I should do. I should try, but it's not. I've had that law enforcement background, and I've not come into contact with that kind of thing. That I'm not one of your guests who can talk about experiences in those ways. Although I have been thinking about the idea of trying something like that, because obviously I'm somebody who is damaged, and maybe there's a way I can publicly advocate for the benefits of them. But I'm in a tricky situation. It's been it's an odd decision for me, because essentially one of the great things that LEAP can do is reach very conservative audiences. It's a very difficult decision for me to do anything different, because I don't want to present to a conservative audience a mixed message or something that, without sitting them down very carefully and explaining to them that this is something that they shouldn't shy away from. So it's really tricky. We have members who are keen to work with Heroic Hearts. Are they called Heroic Hearts?
Heroic Hearts, yeah.
To do to use their services, and hopefully we can arrange to do that soon if they are appropriate people to use their services, and then we could have very useful public revelation. We could have, assuming that it was a benefit to them, then this is going to break down some barriers, because people hearing about cops doing this to cope with damage that's been caused by the war on drugs, then that could be very powerful. And I anticipate it being powerful, because let me make it clear, we have lots of members who have mental health problems, all of which have been caused by fighting the war on drugs.
Yeah, and just to explain what Heroic Hearts is for people who don't know, it's an organisation which enables returning sort of service people, enables them to go and experience work with plant medicines, in this case kind of ayahuasca or psilocybin, in completely legal environments in countries where the medicines are legal, like for example Peru or Netherlands in the case of sort of psilocybin. And the kind of the anecdotal and scientific evidence is becoming kind of overwhelming in the effective treatment of, for example, PTSD or kind of other associated sort of mental issues and traumas. In my own experience, mine was more of a kind of quite run of the mill. I had I have a perfectly kind of normal, in inverted commas, career, nothing on the extreme ends, kind of a normal suburban, pretty dull life really. But, just subject to the usual kind of stresses and strains of life. I'd find myself in a situation where my kind of marriage was under a bit of pressure, and was looking for a way to sort of, change the dynamic in my own life in terms of the way that I was handling, stress and pressure. And, went and tried a kind of not a Hail Mary as such, but went and tried the, the kind of Peru experience, and went and had a kind of transformational experience where, I just found that something had fundamentally shifted in my kind of, thought processes and the way that I approach life. And so that's why I'm here, is, back to your kind of, sort of advocacy kind of play where I feel like it's my kind of responsibility to try and provide more information to people, to have a bigger discussion around prohibition of these medicines, because it kind of misuse of drugs covers psychedelics as well, right? They're considered to be as dangerous in sort of the legal framework as heroin. Street heroin is the same as magic mushrooms, I think, even in terms of classification.
Well, yeah. I mean, if you look at the schedules, they're considered more dangerous than heroin, because heroin can be prescribed by a doctor, and can be researched. So as cocaine, it can be researched for new treatments without much difficulties. But the psychedelics are in Schedule 1, which means that they are deemed in law to have no medicinal benefit, and so they can't be easily experimented with, which means that, for example, the wonderful paper that came out of Drug Science published for the treatment of previously untreatable depression, the study they did with that. I was speaking to David Nutt about how difficult that was to actually do and how long it took to put together. It's an extraordinarily expensive. The most expensive part of the trial was actually getting the legal, legally allowed, the certification, the license to do it, and the cost of actually sticking to the terms of that license in terms of the movement of the psilocybin and how it's stored and all of those kind of things. It's ludicrous, and it is a huge impediment to future research. So yeah, the Misuse of Drugs Act is an abomination for many reasons, but it's an abomination because it restricts the growth of science and understanding of the potential of these substances. And drug policy reform is always about increments. It's always about small battles and how we nibble away at this. And the very important battle at the moment, or one of the very important battles, is to just merely get that Schedule 1 shifted. To get them moved from Schedule 1 into Schedule 2, which means it's much more affordable and easy to actually gather the evidence for the efficacy of these things.
When was the Misuse of Drugs Act sort of enacted?
1971. So that's something everyone should pay attention to, because 2021 is 50 years. So lots of us reformers are going to be working together. We're going to be led by Transform Drug Policy Foundation in a campaign to protest against the continuation of that act, and we're going to be calling for its repeal. That's what the campaign is about, and the campaign is called 50. So everyone, please look out for that on social media. There'll be lots of use of the word number. There's a whole fresh website set up for the campaign, or will be, and there'll be various politicians and various celebrities on there who have contributed to their thoughts on why the Misuse of Drugs Act should be repealed immediately.
So is that something that you're looking for, kind of public involvement in, donations? How can people, add their energy, their kind of resources to these campaigns, either be it kind of supporting LEAP or the 50 campaign? How is it best as people can look it up on the internet, search, is there donate buttons? I mean, how's that working?
Well, I mean, there's various things people can do to help. I mean, first of all, yes, you mentioned the donate, and we're a volunteer organisation in LEAP UK. I mean, in the United States, they're very well funded. They have, but we're reliant on volunteers here. So any financial assistance is very much appreciated. And if you want to help LEAP UK, just go to our website, which is www.ukleap.org, and there is a donate button on there. We will be very much involved in fighting that campaign throughout 2021, various speaking events and other activities. What you can do apart from that is you can get involved on social media and support all of the relevant reform organisations. So follow LEAP UK on Twitter and other social media, including Instagram. Share all of our posts, but also follow our allies and follow LEAP Scotland, LEAP Europe, LEAP Scandinavia if you speak any of those languages, and LEAP in the USA, but also our allies, and our important allies is Transform, Drug Policy Foundation, but also Anyone's Child. Now, Anyone's Child we work probably closer with than anyone else, because they're an organisation of families who have suffered in the worst possible way from drug prohibition. They're families of parents who've lost children or had children traumatised by being sent to prison. There's big figures in that organisation like Anne-Marie Coburn, who lost her 15-year-old daughter to an accidental MDMA overdose. And we work closely with Anyone's Child. We do lots of events with them, because there is nothing more powerful to the public than a grieving parent stood next to a police officer or former police officer who are both telling you the system has failed and is killing people. There's nothing more powerful than that combination. So it's brilliant, because wherever we go in the country, you know, we did a series of 3 events in small towns in West Wales last year, for example. And what we can do, we can go to any community and we can get the local journalists there. We can get the local mayor. We can get all the local councillors. We can get the local MP. And we generally do get all of those kind of figures. And so in one big event, we can fill a village hall or a town hall or whatever it is. In one event, we can get all of the local thinkers, political thinkers, in one space. And we can, you know, and we change people's minds, and it has huge influence. A lot of the MPs who are now signed up to the principles of drug policy reform have done so because we have had these events in their constituency. Now think about that. Think about just how powerful that is. So if there's anyone out there who thinks, well, I want one of those events in my town, get in touch. We'll sort it out.
It's amazing. I was thinking just now, is there a kind of economists for drug policy reform? You know, because a lot of times people just don't, you know, they just want to see something kind of in black and white. You can say, right, it's costing us a fortune. You know, the opportunity costs are immense. The time spent pursuing these, you know, vulnerable people in this way is costing immense amounts of, you know, resources which could otherwise be, you know, better utilized to, you know, to kind of, you know, stop something else, which is kind of, you know, more important. Is there kind of a, you know, I was just thinking, is there an economist for drug policy reform kind of group?
Well, I mean, there isn't specifically, but I mean, first thing I'd say is that is a good argument, but it's always the secondary argument, because people don't remember facts or figures, and they're unlikely to be moved by them. People are moved by narratives. And so as an activist, I'm always looking for what the narrative is and how I engage my audience with that narrative. But of course, the backup information is economic. And there's some very basic and powerful facts that it's significantly more expensive to criminalize people than to care for them. Even before you start looking at the effectiveness of criminalizing people. So for example, it costs £45,000 a year to put someone in prison. Many problematic heroin users end up in prison. It only costs £12,000 a year for even the most expensive form of heroin-assisted treatment. £12,000 a year. You know that it's quite simple maths in terms of the comparison. But in terms of economists and whether there's a group of them, well, if you read The Economist, the great publication written by economist journalists for economists and other interested people, their editorial position has quite consistently for some time been in favour of drug policy reform. And you know, and I consider that, I mean, I love The Economist. I think it's a brilliant magazine. But I'd recommend a book by one of their correspondents called Tom Wainwright. It's a book called Narconomics. Now, Tom was the Economist correspondent in South America for several years. And so he studied the situation there. And his book is the most brilliant breakdown and analysis of the situation there from an economist's point of view. He breaks down the economist's arguments into narratives. And that's what I find so useful. It's a brilliant book, and he's a fantastic guy. If you don't feel like reading the book, at least listen to the Stop and Search podcast where he's on as a guest. So you just search on the listings and Stop. The guy is brilliant. And also there's a short film by Vice which was brought out about 10 days ago, written by my co-writer J.S. Raffaeli, and it's about cocaine, and it's about the economics of cocaine. It's only like 12 or 13 minutes long, but it's got this lovely little interview, like just a few seconds clip from Tom Wainwright, and he does this superb explanation of the cost effectiveness of United States policy in America, South America, and it's a narrative that will stick with you because he uses the analogy of the cost of paint behind an oil masterpiece. So that I recommend that as well.
Right. So that's the end of part 3. Part 4 to come. Thanks for joining in. Please like, subscribe. Do all the things we need to do on social media. Thanks for watching.